Ever find yourself caught in that relentless loop of what ifs, maybe spiraling over uncertainties, even when, a part of you knows it's probably okay?
Mm-hmm.
Chronic anxiety, well, in its many forms, it's a challenge so many of us either experience directly or see in people we care about.
Absolutely.
Today, we're taking a deep dive into precisely how it works, and maybe more importantly, how we can effectively tackle it using this really precise framework called Rational Emotive Behavior Therapy, or REBT.
Right.
Think of this as your shortcut, a way to understand the mechanisms behind things like generalized anxiety disorder, health anxiety, even phobias, and also the powerful intervention.
Exactly. Our mission today is really to give you a roadmap. So by the end of this deep dive, you'll have a much clearer understanding of how anxiety is actually conceptualized in REBT.
Okay.
We'll show you how to distinguish the specific inferences and beliefs, the things that really fuel different anxiety presentations, not just in theory, but by looking at real-world scenarios using the ABC model.
That ABC model is key, isn't it?
It really is.
Yeah.
And crucially, you'll grasp how a whole range of cognitive, behavioral, and emotive interventions can be applied with, well, a new level of precision to bring about lasting change. It's about peeling back those layers.
It's getting to the core.
Exactly. Getting to the core of the issue.
Okay, so let's unpack REBT's core ideas. For those maybe already familiar with the ABCs, we're going to dig into the subtleties here. How A, B, and C play out specifically in chronic anxiety. Can you maybe quickly remind us of that ABC framework? But, keeping an eye on those crucial anxiety nuances.
Certainly. So at its heart, REBT reminds us that A, that's the activating event, isn't what truly dictates C, which is our emotional and behavioral consequence.
Right, we often think A causes C directly.
Exactly. But it's B, our belief system, our evaluations, our demands about that event that's the bridge. That's what really links A to C. REBT kind of flips that common sense script.
Okay.
And in anxiety, that A, the activating event, it isn't just any event, is it? It's almost always some form of perceived threat.
Threat. Okay. So it's about perceiving or maybe just imagining something dangerous or harmful or just utterly intolerable might happen.
Yes, that's the fundamental A for anxiety.
But here's where it gets really interesting, and I think this is so crucial for effective intervention. It's not enough to just know the general category is threat.
No, definitely not.
You have to identify the very specific inference tied to that activating event, like the client's exact feared outcome.
Precisely.
The difference between, say, something bad might happen and I might get trapped in this elevator and suffocate, very different things.
Absolutely. That specificity is everything. A lot of people think if they just avoid something, the fear will eventually fade.
Right, seems logical.
But REBT shows it often reinforces the belief that the threat is real and, crucially, unbearable. If you don't pinpoint that exact feared outcome, your interventions, well, they'll be far less effective. It's like you're fighting a ghost instead of a specific monster you can actually grapple with.
That makes perfect sense. So, okay, the core is always some kind of threat inference. But what's fascinating is how this threat actually looks different in various anxiety conditions. Can you break down those specific flavors for us?
Yeah, absolutely. Well, the core concept is always threat. The manifestation, how it shows up, really changes. Take generalized anxiety disorder, GAD, for instance.
Okay.
Here, the threat is often diffuse, kind of free-floating. The inference is often something like, something bad is going to happen and I won't be able to cope. It's this pervasive sense of impending doom, almost.
Very vague, but very powerful.
Exactly. Then you have health anxiety. Here, the threat is a catastrophic misinterpretation of bodily symptoms. The inference jumps very quickly to, this chest pain must mean I have a serious illness.
Even if doctors say otherwise.
Precisely.
Right.
And finally, with phobias, the threat is usually very specific and immediate. The inference is crystal clear. If I face this spider or this elevator or this situation, something terrible will happen. Each time has its own unique target for that perceived danger.
And what about the underlying beliefs? You mentioned the B earlier. What are the typical dysfunctional beliefs that sort of fuel these distinct expressions of anxiety? Because it seems like it's not always just about the threat itself, but maybe our demands around the threat.
You're absolutely spot on. We see a few common patterns.
Right.
First, you have these demands about the threat. These are rigid, often quite unhelped beliefs like, this danger must not exist, or I must be absolutely certain it won't happen. That demand for certainty is huge in anxiety.
That must is a powerful word there.
It really is. Then There's low frustration tolerance, or LFT. This sounds like, I couldn't bear it if this bad thing actually occurred. It's that feeling, maybe we all get it when the Wi-Fi drops suddenly that I can't stand this woman.
Yeah, I know that feeling.
Right. But imagine that cranked up to 11, applied to something genuinely important or scary. I couldn't stand the uncertainty. I couldn't stand feeling anxious.
Okay, that makes sense. And the third one?
The third is global negative ratings. These are harsh, often really unwarranted judgments, sometimes about oneself. I'm weak, I'm pathetic for feeling this way. Sometimes about others, they can't be trusted to help me. Or even about the world or life itself. Life is just unsafe, it's unfair. These beliefs aren't just passive thoughts. They actively fuel the emotional fire of anxiety.
Wow. So if those are the cognitive roots, how does this anxiety actually drive what we do, or maybe what we don't do? What are the behavioral implications here?
Well, what's really crucial to understand is that anxiety has a very predictable behavioral output. It primarily drives avoidance.
Right, avoiding things.
Avoiding people, places, certain sensations, even specific thoughts sometimes. And it also powerfully drives reassurance-seeking.
Like constantly asking, are you sure it's okay?
Exactly. Constantly asking others for certainty, checking things repeatedly, or, compulsively researching every minor symptom online down a rabbit hole.
We've all been there.
We have. But the critical point here is that both avoidance and reassurance-seeking actually prevent genuine self-change. They might offer some temporary fleeting relief, maybe for a few minutes.
Yeah, a quick fix.
But they actually keep the anxiety firmly locked in place over the long term. They reinforce those problematic beliefs. It's like pouring gasoline on a small flame thinking you're putting it out.
That's a powerful analogy. Okay, to really bring this home, let's look at how this ABC model plays out in some specific scenarios. This should give everyone listening a really tangible grasp of these concepts. Let's start with Maria. She's 34, struggles with GAD, Generalized Anxiety Disorder, worries nightly, finances, kids' safety, her job. She often says things like, something is going to go wrong, I'll lose control, I just won't cope. Where would you even begin to untangle that web of worry using REBT?
Well, for Maria, the A's, her activating events, could be almost anything. Bills arriving in the mail, seeing her children playing outside, even just the thought of possible workplace downsizing.
So lots of triggers.
Lots of triggers. Her beliefs and inferences seem deeply rooted in these rigid demands. A disaster is coming, and I must prevent it. And crucially, I can't stand uncertainty. That intolerance is key.
Right.
And the consequence, well, it's that chronic tension, the fatigue, the irritability she feels, and this constant avoidance of making decisions, it paralyzes her.
So it's not just the worry itself, but her demands about certainty and coping that are the real levers for change.
Precisely. That's where the work needs to happen.
How would REBT specifically help Maria disrupt that pattern then?
We'd help her dispute those demands for certainty. Gently, perhaps, asking questions like, where is it written that you must know the future with absolute certainty? Cognitively, we challenge the idea that uncertainty is truly intolerable rather than just uncomfortable.
Okay.
Behaviorally, we might introduce strategies like scheduled worry time. Literally, giving her permission to worry, but confining it to a specific slot, say 15 minutes a day, and then actively postponing worries outside that time.
Containing it.
Containing it. And also gradual exposure to uncertainty, perhaps by deliberately leaving minor tasks undone for a short while. And emotively, we could use something like rational emotive imagery. She'd visualize a feared event, practice feeling the anxiety without demanding it go away, and rehearse affirming more rational, coping-oriented beliefs.
That sounds incredibly practical and, well, empowering.
Hmm.
Okay, let's move to James. He's 42, experiences occasional chest tightness. Now, despite multiple medical tests confirming he's perfectly fine.
Right. The objective data says he's okay.
Exactly. But he fears heart disease. He's compulsively Googling symptoms, constantly seeking reassurance from his spouse.
Yeah, a classic health anxiety presentation. Jones's A is that physical sensation, the chest tightness. His B, the critical inference, jumps straight to, this means I have heart disease.
Ignoring the test.
Ignoring the test. And this is coupled with underlying beliefs like, it must not be true that I have this, and if it is true, I couldn't handle it, I'd be doomed. That low frustration tolerance again and catastrophizing.
Okay. And his C. His C manifests as acute panic, that obsessive reassurance-seeking and compulsive checking behaviors, constantly monitoring his body, Googling symptoms. The internet becomes his worst enemy in this state.
Yeah, I can see that. So what's the REBT approach to help James unhook from that cycle?
Cognitively, a big part is helping him identify that inference error. The lead he makes, A physical sensation does not automatically equal a serious disease, especially when evidence points otherwise. We dispute his demands for absolute certainty about his health, asking things like, where's the universal law that says you must never experience health uncertainty?
Challenging that need for 100% certainty.
Exactly. Behaviorally, it's really about reducing and eventually stopping that reassurance-seeking, and using something called interoceptive exercises, deliberately inducing some mild physical sensations like shortness of breath from climbing stairs quickly in a controlled way to show him they aren't catastrophic.
Facing the sensations directly.
Facing them directly, yes. And emotively, maybe something like rational role play could help, getting him to argue against his catastrophic fears, perhaps taking on the role of his doctor, presenting the rational evidence.
Powerful stuff. Okay, one more. Let's consider Sonia, 29. Intense fear of elevators. She avoids them completely, even if it means climbing, say, 10 flights of stairs. Her reasoning is, if I get stuck, I'll suffocate or I'll panic to death.
A very specific phobia. Sonia's A is either actually entering or even just imagining entering an elevator. Her B, that inference, is stark and immediate. I'll get trapped and die.
Very catastrophic.
Extremely. And this is bolstered by beliefs like, I must avoid this at all costs. And again, I couldn't stand it.
Yeah.
The low frustration tolerance applied to the feeling of being trapped or panicking.
Right. And the C is obvious then.
Yes. Severe anxiety, complete avoidance of elevators, and as a result, a significant limitation on her daily life. It's a perfect example of how avoidance really reinforces the belief that the situation is truly dangerous and unbearable.
So how do you help Sonia face what, to her, feels like an absolutely existential threat?
Well, cognitively, we directly dispute that catastrophe.
Yeah.
Okay, let's assume you did get stuck. Would discomfort, even intense panic, truly equal death by suffocation? We challenge the absolute nature of that extreme feared outcome.
Bringing probability and reality into it.
Exactly. Behaviorally, it's all about graduated exposure. That's the gold standard here. Starting small, maybe watching elevator videos, then standing near an open elevator, then standing inside with the door open, eventually riding short distances with support, then longer, then alone.
Step by step.
Step by very manageable step. We encourage her to rate her actual distress during the exposure versus her predicted distress beforehand. Often, the reality is much less intense than the fear predicted.
Seeing the difference.
Seeing the difference. And emotive techniques like rational role play, where she might even exaggerate her fears to an absurd level, the elevator will plummet into the Earth's core, can sometimes help loosen those rigid beliefs by using humor and perspective, making the perceived threat seem a bit less monumental.
It's really fascinating hearing these examples. What strikes me is the sheer precision required in each case. It's not just anxiety, it's this specific inference and these specific beliefs.
That's the key takeaway.
It seems even skilled practitioners, or frankly, those of us trying to apply these principles to ourselves, could easily fall into traps. So, what are the most common pitfalls when tackling chronic anxiety with REBT? And maybe more importantly, what are the simple course corrections to keep things on track?
You're right, precision is everything. And it is easy to miss the mark.
Yeah.
One of the most common traps, I think, is getting lost in the symptoms instead of the source.
What does that look like?
It looks like accepting a vague fear, like, I'm just worried something bad will happen, without pushing for more detail. Or maybe spending too much session time solely on relaxation techniques or symptom management.
Okay. And the correction?
The correction is always to push for specificity. Ask yourself or the client, what exact bad thing are you afraid of? What's the absolute worst-case scenario playing out in your mind right now? Get really concrete. And remember, while symptom management tools like relaxation are useful supports, you always have to return to belief change. Without challenging those rigid demands, musts, shoulds, and the intolerance beliefs, I can't stand it, the underlying anxiety will likely persist.
So it's not just about feeling better in the moment, but changing what's driving the need to feel better.
Exactly. Another really big trap is accidentally feeding the beast.
Feeding the beast.
Yeah, this is when we, or maybe well-meaning friends or family, collude with the avoidance or the reassurance-seeking. Constantly providing that certainty the person craves or helping them avoid situations that trigger their fear.
Trying to be helpful, but maybe not in the long run.
Precisely. The correction here is to kindly but firmly redirect. Frame exposure exercises not as ordeals, but as opportunities to practice courage and build tolerance. And gently remind yourself, or the client, that seeking reassurance in the long run actually keeps the anxiety alive. It prevents them from learning they can cope on their own.
That's such a tough but vital truth. What else do we need to watch out for? Any other common traps?
A third one I see quite often is forgetting to use the whole toolkit. Sometimes we might overemphasize just talking through the cognitive disputation, the challenging of beliefs.
Staying in the head too much.
Exactly. Staying too much in the head without enough behavioral follow-through. If you only talk about change, the change often doesn't stick as deeply. The correction is absolutely critical. Pair the cognitive disputation with behavioral experiment.
Taking action. Taking action. Show yourself, or help the client show themselves, that acting against the avoidance, doing the feared thing, strengthens those new rational beliefs far more effectively than just talking alone ever could. And also, don't forget the emotive techniques we touched on: imagery, rational role play, maybe even shame-attacking exercises for social anxiety. They help you feel the change deep down, not just intellectually understand it. They add a really powerful emotional punch to the process.
That makes so much sense. You need the head, the heart, and the feet all working together.
Delicately put, yes.
Wow, what a fantastic deep dive into the practical application of REBT for anxiety. It's so clear that this framework offers such a systematic, compassionate, and incredibly precise approach to confronting and transforming these really pervasive struggles.
It truly does. And I think the profound power of REBT really lies in that precision we've been talking about, identifying the exact threat inference first, and then zeroing in on the specific irrational beliefs, the demands and intolerances that underpin it.
It empowers individuals to not just, cope with anxiety, but to truly face uncertainty head on, to actively reduce those avoidance behaviors, and ultimately to build lasting resilience. It's about becoming, maybe, truly anti-fragile to life's inevitable curveballs and challenges.
I love that term, anti-fragile. So maybe as you, our listeners, move through your week, perhaps you might pause sometimes and just observe your own reactions. What specific activating events seem to lead to certain emotional consequences for you? And maybe more curiously, what underlying beliefs, those demands, those can't-stands might be fueling those connections, even in the smaller anxieties of daily life? It's a really powerful lens for self-discovery, isn't it?
It really is.
Thanks so much for joining us for this deep dive. We'll see you next time.